In the last 90 days, healthcare has been transformed, and we need to talk about it. In January, OpenAI launched GPT Health. 230 million people were already asking it health questions every week. In March, Microsoft launched Copilot Health, pulling in medical records, wearable data, lab results, and they are fielding 50 million health questions a day. 2 weeks ago, Perplexity launched Perplexity Health, connected to 2.4 million healthcare providers. That is three of the largest AI companies on the planet launching dedicated health products in under 90 days. And regardless of why you think they are doing it, or what industries are behind it, or who is going to be helped by it, the reality is that in the last quarter, the way you deploy care and position your services has changed forever. My name is Dr. Meghan Walker. I am the chief cheerleader at Clinician Business Labs. Over the course of the last decade, I have worked with over 2,000 practitioners around the world to help them optimize their practices and their clinical deployment of care. For almost 16 years, I worked as a naturopathic doctor, working with patients on the front line. I was an innovator and an early adopter with respect to online business practices, AI solutions in practice. And my goal really is to not only have you fall in love with your practice again, but to help distribute our respective systems of medicine to as many people as possible. See, here's the truth. When I have conversations with practitioners, the number one thing they say they want to do is to be able to help as many people as possible. Equally, when I ask them to describe who their ideal client may happen to be, they want someone deeply committed, someone committed to doing the work, to doing the labs, to taking the supplements, to changing their diet. Those are not necessarily the same people. Things are changing rapidly with respect to how we deploy care, how we monetize our practice, and how we actually reach more people. Patients can now upload their labs, connect to wearables, get personalized health guidance from AI that is less than $20 a month or free. These tools are not vaporware, they're not beta products, they're not coming soon. They're in the marketplace right now, and they're backed by some of the biggest companies in technology with hundreds of millions of users already in their funnel. This is not a conversation for a later day. These are real life shifts and changes that are happening in front of us. The same way COVID forced us to reevaluate how we practice in an instant, so too have these innovations that are really hitting the market even right now. And so this conversation is not necessarily meant to perpetuate fear. It's not meant to make you scared of the future, to want to stick your head in the sand. It's actually to equally balance the conversation related to what needs to change, what has already changed, and what opportunities are sitting on the horizon. Because here's the reality. Your cheapest offers, the ones you always tried to make accessible to the most number of people, they just became obsolete. The AI tools like GPT Health, Perplexity, etc., are making functional and integrative medicine way available to way more people. Your primary offer, pay me $150 and I'll tell you as much as I possibly can, and I'll load it all into this handout that I give you on the first visit to maximize the amount of value that you receive so you can justify charging people. That's available to them here for $20 a month or for free. The good news is you're not going to have to engage in that much longer. And the opportunity is that you are going to be able to start to have more conversations with your ideal client, the ones who truly are looking for transformation. See, most practitioners currently have one type of offer, a clinical consult, a modality. They have one delivery method, one price point, one way of doing it. Practitioners need to start to think about how they're stacking their offers, how they are creating predictability in their practice with those ideal clients, the ones who do want to do all the work, the ones who are willing to pay and make the commitment. That becomes the foundational layer. And then we leverage innovation. We leverage AI tools to be able to reach more people with our unique vantage point. This is where we're able to pull in group programming, perhaps online programming, perhaps even our own AI-driven apps. Your audience is going to shift slightly. Those bargain hunters, we call them the tire kickers, the ones who are already price sensitive, the ones who are shopping around, the ones who negotiate on how many supplements they need to take and for how long, they are going to turn to AI because it is cheaper. And for them, just as effective. Your real audience, however, the ones who are truly going to support your business and frankly enable you to realize and experience the full potential of the medicine that you hold in your hands, those are the ones who understand that AI alone is actually not going to deliver for them the transformation. This is going to create absolute clarity in the marketplace around who it is that you can truly serve and who it is who wants what it is that you are packaging. You're going to have the opportunity to create foundational, predictable income from this cohort, not one-off appointments where we're selling people and sometimes begging them to come back in. You aren't going to have to keep reselling what it is that you are going to do. Your ideal clients are going to float to the surface. So here's the part that most people are missing. AI is not just disrupting how we are going to practice. It is not just taking away that cohort of individuals who are willing to pay us the lowest possible price. It's also creating massive operational upside if, and only if, you're willing to lean in. We have been plagued by an ongoing challenge in our industry, and that is extremely low profit margins, a huge amount of energy deployed and delivered into our practice in order to squeeze out a small amount of economic value. Last year, I sat with 3 colleagues looking at how we could reorganize what's happening inside their practice as they prepared to enter bankruptcy proceedings. This is a very challenging business model because it is labor intensive, not just labor intensive in terms of people we need to hire to support us, but if we can't do it, then we're doing it all ourselves. And it burns us out, even if we think we're going to be the ones who can escape the burnout. I have almost never met someone who was able to move and navigate their entire career unscathed. AI presents a tremendous opportunity for us to add operational efficiencies. And we're already seeing that at the highest level within the system. And we need to look to the broader healthcare systems to understand where the big picture leakage points reside. One of the areas where we're seeing tremendous feedback immediately is simply in the management of no-shows. Understanding how much revenue is leaked through people not showing up either on time or at all. The average no-show rate in outpatient care runs between 18 to 30%. In a big practice, maybe not yours, but like a big practice, this can translate into upwards of $150,000 per year in lost revenue. And then every missed appointment is not just the lost revenue of those people, it is infrastructure and human resources to follow up and text the patients and reschedule them. Self-scheduling tools alone reduce no-shows by up to 30%. This is not just a technology solution, it's a revenue recovery tool. When we look at front desk inefficiency, manual data entry, intake processing, phone-based scheduling, paper forms, these are all solvable problems right now in this moment. And this is not about displacing human jobs. This is about creating maximized efficiency at your front desk. This is about increasing the capacity of your practice to move more people through, to dedicate the time of your front desk, not to following up with patients who missed their appointment, but to reaching out to people who would benefit from your care. Only 19% of medical practices are currently leveraging AI chatbots or virtual assistants for patient communication. This is a massive adoption gap. This gap is your competitive advantage. If we can increase the profitability in your practice, we make your practice more sustainable. We give you more revenue to take home. We give you more revenue that you can reinvest to reach more people. When we talk about marketing automation, and I call this the silent margin killer, most practitioners treat marketing as the last priority after patient care because we have actual legal obligations to providing the best possible care. We have a license on the line. So we can't not follow up or make the phone calls about blood work or take care of some of the little things at the front desk and prioritize our marketing when we have a different onus of responsibility from other service-based businesses. And what happens is when we spend all of our time managing the work over here is that our pipeline tends to run dry. And then we go into panic mode where we try to get new patients in, and we're in an ongoing cycle. It depletes our energy, it depletes our capital, but it frankly depletes our desire to keep doing this. Clinics using automated marketing workflows. So workflows are where we make decisions about this step leads to this step leads to this step, and then aligning the tools that move those pieces forward. They recover 18 to 15% of inactive patients. Personalized email sequences improve engagement by, wait for it, 140%. If you can increase engagement by 140%, not only does this affect your bottom line, but more importantly, it affects your ability to deliver effective care, to reach more people. People are busy. Proactive care is usually people's last priority when they're dropping their kids off for school and they're running around and they're taking care of spouses and they have real responsibility in their own lives. If they're not in imminent, immediate pain, we often move down the priority list. If we can increase re-engagement by over 140%, not only do our practices win, but our patients win as well. See, here's the bottom line. The private sector is where all of this gets deployed first because we're not crippled by policy constraints and union negotiations and all of the red tape that frankly enable us to implement these things fast. We get to move. And the practitioners who move first are the ones who are going to see expanding clinical margins, better patient outcomes, and practices that run with less friction than anything we have seen before in our industry. This is going to be the moment that enables us to reach more people. And frankly, this is why this conversation matters so much right now. And it's not about you having to learn all of the tools. Looking at AI as a solution in your practice simply requires that first and foremost, you are willing to put up your hand. The time frame to start to understand AI, to learn the concept of a workflow and the benefit and opportunity of a well-constructed prompt, this isn't a 12-week crash course. This is a decision to put up your hand. AI adoption in healthcare is accelerating faster than almost any other technology in the last decade. Let's talk about hospitals for a second. Hospital use of AI for scheduling went from 51 to 67% in 1 year. It's going to be transforming around you. You can't afford to not put up your hand. Billing deployed through AI jumped from 36 to 61%. These tools are not just waiting to be ready, they are being implemented right now. And practitioners who engage in this moment, who match that pace, who understand what is changing, they are going to have a structural and emotional advantage in the marketplace. This is not about you having to become a technology company. This is simply about you acknowledging that it will be a requirement, not in 12 months, but within the next 12 weeks. And putting your hand up and acknowledging that you are curious to learn more. That is simply where it starts. To help bridge this curiosity gap, and in some ways, a courage gap, we're going to have a conversation at what we're calling the GPT Health Town Hall. And it's going to be taking place on April 21st. It's entirely free, and I invite you to join us. We're going to be talking about what is on the horizon in terms of opportunity in practice. We're going to be talking about the types of tools that patients are going to access. We're going to talk about the language that we can use in our own practices in order to reach more people, to dissuade people from simply thinking that this is all of their solutions, and to really delineate what can happen on your phone and what needs to happen in an office, where we can talk about where the limitations of AI currently reside and the opportunities of walking into clinical care. This is not going to be a tech demo. This is not going to be any particular training. It's a strategic conversation about what's happening right now and what to do about it. We're going to talk about how patients are discovering and choosing practitioners differently, where there is real risk to your business, and how to make clear decisions in the next 12 weeks. Registration is free. A full replay is accessible if you can't attend the live talk, because I know you're super busy. The link and the full description of the event are down below. If there's one last thing I just want to share, is that what we can't afford to do in this moment is become invisible. We can't put our head in the sand, and we can't think that this is just one more thing that we're going to be able to float through. Those people who really accelerate in this moment are going to be the ones who lean into curiosity. You don't have to like it, but you do have to have the courage to be curious, to lean in, to put up your hand, say, I'm willing to learn more. Because if you're truly committed to wanting to reach more people, then that opportunity is literally at your fingertips. So not only can we not afford to be invisible right now, we definitely can't afford to be uninformed. To help you with that, we're running our town hall and we'll see you on April 21st. Throw me your comments below, subscribe if you want to hear more, and we'll see you at the town hall.